I'll tell you that here at the hospital, patients are surrounding the outside of the pavilion of the hospital. They're on gurneys and on the lawns outside. There is one building that we've established is stable enough to receive patients. So we have started moving patients in there, and we are going to be treating some in there and some outside. About 50 feet away from our command post are about 200 bodies that have been piled up and, essentially put there until they can be removed. So the smell is starting to get very bad here, and the flies, and hopefully people will be able to start removing them. We're working to get medical supplies in. We just had a shipment come in today that arrived at the airport, and we just collected another large amount from the WHO, the World Health Organization, which we brought over to the hospital. I mean, the infrastructure here is so damaged that it's going to be very difficult to get potable water. We need generators at the hospital because electricity is out in some areas, and we have to be able to work outside. So the buildings are not stable enough to hold patients inside, and also people are just too afraid. I have seen only one rescue operation, and that was at the police headquarters that was almost completely flattened. And they had large lights up, and we're doing an actual rescue operation. That was the only one I've seen. There may be many others, but I have not seen them. This takes a lot of, quite frankly, money to do these kinds of operations, and it's very, very difficult work, and we appreciate their help and paying attention to what's going on, and we'll stay here as long as it takes to rebuild the infrastructure and get people back and taking care of themselves in the long term.